Days after 5 people died in an Ebola flare-up in Guinea, residents of the capital Conakry are worried of a fresh outbreak. Guinea is on the road to recovery following the devastating effects of the virus. And just when many in the West African country thought they could be getting back to normal ways of doing things again, a flare-up in the south of the country is worrying to some residents. The government says at least 800 contacts have been identified and are being monitored following the deaths of 5 people in a village 1,000 kilometers from the capital. Korapara, where the flare-up was recorded, had 24 infections in the initial outbreak with 15 deaths. The World Health Organization says the flare-up should be expected, and countries hit by the epidemic need to maintain capacity to prevent, detect and respond to further outbreaks.
Oui, je pense que l'Ebola a été géré.
I think the government did an okay job in handling the outbreak, especially since they had to source for funding and at the same time to help fight the disease. I'm worried though about the new cases because this could imply that we might live in constant threat of another outbreak. Fighting an epidemic isn't easy, especially in a country like Guinea, but we must also be very vigilant and not forget to keep on with the measures we had during the outbreak.
We're now joined by our correspondent Celestine Carone, who's standing by in the Guinean capital, Conakry. Celestine, what is the exact number of casualties of this recent flare-up in Guinea?
Well, Penina, the number still remains at 5 dead from that March 17th flare-up, and the government says they are still monitoring the other 800 or so contacts. Penina. Now, this is a place, Penina, that is quite far from the capital, Conakry, at least 1,000 kilometers from the city, Korokpara, and Macenta is where they registered those cases, Penina. And it's a bit remote, so the flow of information was a bit of a problem initially, but right now government officials say they are on the ground. WHO also sending a representative or two, Penina, to make sure that there are no more deaths, Penina. The quarantine is in place as well, and remember, this is a place where, like you mentioned in the story, they had 24 cases and 15 deaths, and one would actually think that the minute they saw someone with the symptoms almost like Ebola, they would have called in the authorities, but the officials say that the fact that they were called in very late is what was part of the problem. But Penina, it still remains till now only 5 dead.
So, Celestine, out of the 800 you mentioned that have been quarantined for the last 21 days, have any of them shown any symptoms yet?
Well, Penina, it's been just a week or so right now, and the government says none of them have actually shown full-blown symptoms of the virus. Now, something to mention something about that quarantine, Penina, people here in Guinea are a bit concerned that the quarantine is just in theory, because they say that the area is really not on lockdown. People are able to move around. There's inflow in and out of the area, Penina. People are moving freely. People are still going to school, going to work. So they say that they are not quite sure whether these 800 are actually being contained per se, or it's just government's way of saying, look, we are a bit in control here and that we should not worry. But Penina, so far, no full-blown symptoms have been registered of the virus there.
During the last outbreak, Celestine, the rapid spread of the epidemic was blamed on cultural practices with more than 11,000 deaths. So after that, have Guineans learned from their mistake, or is it still a problem?
It looks like it's still a problem, Penina, because like the first death we are told here in Korokara when the flare-up began, when the family member passed on, the relatives went back to the cultural practice of washing the dead body, some of them even showering or anointing others in the water that had been used to wash the dead person, and that is how the virus spread at that time. And so, Penina, it looks like once the country was declared Ebola-free late last year, people fell back to old habits, and there's a big concern here, Penina, because even in the city here in Conakry, when you walk around, all hotels, all major institutions have sanitizers at the door, have water that you must wash your hands before you go in. But we have gone to 3 or 4 places here where the water is not being refilled. Nobody washes their hands anymore. Nobody uses a sanitizer anymore. And so it is a big concern, especially the World Health Organization has said they must maintain the measures that they had when they had the full full-blown outbreak, Penina. And so it is a bit concern. This laxity, Penina, is a big concern here for the people, and they're just hoping that the government can resensitize people to make sure that they avoid another outbreak, Penina.
All right, Celestine Karine in Conakry. Many thanks, Celestine.